So I'm, again, a computer scientist, so I'm kind of learning about public health. And from what I've learned, most data comes through things like surveys and clinical visits. And that's way too slow for me because, again, I'm a computer scientist. I'm used to downloading data. That's where I get into this in terms of social media. There's tremendous amounts of data we can download and just use. Actually, I got into this because I was doing stuff with clinical data, and while I was waiting for the IRB approval to come through that, I started social media, and still waiting for the IRB approval for the other project. You think I'm joking. So basically, social media reflects the ongoing lives of a massive population. Health is a big part of that population, and so we want to do lots of things with that data about health. All right, so all the things that we talked about today apply, and you guys know this. Where I'm coming at these problems from is, again, CS. So I'm an expert in natural language processing, statistical machine learning, and large-scale data processing. Right? Those are the things I do and I know well, and the public health stuff is what I'm trying to pick up. So let me give you a couple of examples of what we've done in this area with these sorts of methods. The first one I'll give you a little more detail on, and the other ones I'll go through a little more quickly. The first one is disease tracking. So this is where you can all groan because you've all heard disease tracking using Twitter. So hopefully I'll give you something new today because there's some new stuff in here. But the idea here is that we want to track disease using Twitter, and more specifically, we tend to do things like influenza, although there are other people who looked at other stuff as well. There's two reasons. There's basically 2 reasons you can think about doing this. One is it's much faster. So the CDC takes 2 weeks to publish flu numbers on their website, whereas we can do it in real time. There's also been a paper recently that said it's not just that that's the difference, but when you get sick, the first thing you do is tell people you're sick. And then if you don't get better after a couple days, you go see the doctor. Well, that couple days tends to be, it looks like 4, judging by Twitter. And so basically, even if the CDC was instantly collecting data from doctor's visits, people tweet about it way before they end up going to the doctor. So we can get data much faster. So the other use of this is to complement data, or to fill in gaps of data we don't have. So in the US, we've got pretty good data, but there's other places, other countries in the world where we don't have that data. We can try and fill in those gaps. And there's others. So let me just show you an example. This is the current flu season. The black line here is the CDC's estimate of the flu season. I use the word estimate because there is no ground truth. No one really knows how many people in the country are sick with the flu. That's kind of a strange question if you really think about it. Like, do you have the flu? If you have it but you haven't developed symptoms, if you have it but it's not no longer transferable and you've basically recovered but it might still be in your system, right? So it's a nebulous question. But the CDC's black line here is what they think the rate is. Google Flu Trends is, I guess, the green line, and the line you should look at here is the blue one, which is our let's just call it super fancy processing of Twitter, which you see correlates really well to the other mechanisms. What I want to point out here is basically the other line, the red line, is more of the standard way of processing Twitter, and this is this past season. So for those of you who probably remember, it wasn't that long ago, there was a major epidemic of flu in the United States, and so lots of people were talking about it. These spikes you see here in, let's see, over here in the beginning of December and the beginning of January, those spikes are CDC releasing a press release saying there's a flu epidemic. In January is the CNN, New York Times saying there's a flu epidemic. So the red lines are spiking because everyone on Twitter is talking about the flu, but of course that doesn't mean any of them have the flu, they're just talking about it. So our blue line tracks much, much better the CDC data. To give you an example here, our results are about 0.77. This is Pearson correlations. Google's are about 0.92. I don't have the number offhand for the other Twitter baseline, but it's much, much lower. Something else, this is kind of exciting in that you guys are some of the first people to see this plot, and we haven't published it yet, and to the best of my knowledge, no one has done this. This is our estimates for the current flu rate in New York City. All these lines are New York City lines, same methods. The reason we're able to get this is the New York City Department of Public Health has one of the best surveillance networks in the United States. There are very few other cities that have networks like this, so we're able to go to them and get data and actually see how well we can predict on a city level. And here we do very well. Here are the wrong numbers. Google, which is a new experimental beta out for cities, Google Flu Trend Cities, is 0.98. Twitter is 0.82. This is an updated curve. I don't have the correlations run. You can see we have it now out to the end of February. And you can see this massive spike, which was everyone talking about the flu, but of course people didn't really have the flu in that proportions. To give you another indication of success, so I find correlation kind of a funny thing. What I find much more interesting is, can we predict where the flu rate is going? So a very simple metric, we said for all the weeks so far this flu season where there was an above average change in the flu rate, did we guess correctly if it was going up or down, right? That's a much more useful metric, so we guessed correctly every time, all right? So I think that's pretty good. I think that's actually what's going to be useful out of the system, and Google also guesses it every time. We can talk later about why you'd prefer Twitter over Google, but I have a whole list of reasons. So those are some new things with disease tracking. Even if you've seen disease tracking stuff, hopefully this was new. To the best of my knowledge, we have the best system for doing this. When I say that, I mean all the other systems that have publicly made their data available, we are doing better than them. I'm sure someone is doing better than us, but they haven't shared their data. So I get to say we're doing the best. That's the benefit of sharing your data. Let me just show you a couple other things we've done. So we did this study, this was 2 years ago, where we identified what disease or specifically ailment people were talking about when they tweeted about health. And then we went to the CDC's Behavioral Risk Factor Surveillance System. And this is basically a national phone survey that happens every year, where the CDC calls up a bunch of people, about 350,000, and asks them a lot of questions like, have you had a heart attack? Do you have asthma? Are you overweight? Do you exercise? Do you have access to health care? And then they publish numbers by state, right? So we said, very simple question, can we find ailments that roughly align with what the CDC is tracking in terms of risk factors, isolate those by state, measure per capita rates, and see if it makes any sense according to the CDC data. So this is some examples of what we found. So for the risk factor that they test, do you have asthma? We said how many people are talking about allergies. There's a positive correlation there. I'll just point out a couple of these. Exercise is negatively correlated with obesity. The one I thought was really interesting is states that talk a lot about being sick are states that have worse access to healthcare coverage. And the last one, states that people smoke a lot are states where people talk about cancer a lot more. Right? So this was really interesting. I think basically what this says is before you call 350,000 people, why don't you use our system first? It's pretty fast, it's really cheap, and you get some idea of the answer and whether or not it's an interesting question to ask in the first place. This is using the same data. We want to see how people use medications. So we searched for medications like Benadryl, Advil, painkillers, antibiotics, that sort of thing. And we just saw how people were using them by what context in terms of the disease they were talking about. So for example, Benadryl shows up mostly to treat allergies of various kinds, but about 10% of people on Twitter who mention Benadryl actually talk about insomnia, right? Antibiotics, so there was this paper, I can give you the citation I don't have on the slide, that basically manually coded tweets that were talking about antibiotics for correct or incorrect use of antibiotics. So we just checked very simply how many people talk about antibiotics in the context of having the flu. For those of you who don't know, you can't treat the flu with antibiotics. The flu is a virus, not a bacteria. But people don't know that, and our numbers look very similar to this hand-coded study, so we thought that was kind of cool. Something else we looked at was patient safety. This is very different. We tried to find tweets where people reported patient safety issues, medical errors. So these are things like they got the wrong procedure, or there was a mistake in surgery, or they were prescribed the wrong medication. And so we coded this manually for a bunch of stuff like who's reporting, what was the reaction to the mistake, what kind of mistake it is. And so we found things like most reports are by the patients themselves. The next largest group is by relatives. There are doctors and nurses who report mistakes as well. Very interesting. Procedural was the most common mistake. There's also medication errors were the next most common mistake. So the reason this is important is because depending on what number you believe, I'm coming from Hopkins, we have the Armstrong Institute, which has been given a lot of money to fight patient safety errors. So therefore, the number of people who die is very big. To justify all that money. And basically, there are estimates that about 250,000 people die in the United States because of medical error. So we're really good at talking to doctors about that, but we're really bad about talking to patients about what those errors are. So Twitter might be a good source for learning about what patients are perceiving in terms of medical error. So this one I'll go into a little more detail. This is very new, and I really think this is very cool. So we're looking at you can call off-brand or illicit drug use. I don't want to say illegal because a lot of these drugs are not. So these are things that people are doing for recreation, right? And the problem is that the recreational drug market or community is changing quite a bit. It used to be that you could talk about cocaine, crack, morphine, heroin, and that was what was going on. And now there's a tremendous number of synthetic drugs that you can introduce. So a recent EU report found it was 1 a week in Europe. Not all of those make it to the United States. I say make it to the United States because a lot of our drugs come from Europe in terms of innovation. They are the innovation leaders in drug use. We've got technology, they've got drugs. Okay. The problem is that learning anything about these new drugs is really hard because the normal way we do this is we do clinical studies or we ask people. Both of those are really slow and time consuming, and therefore it takes a long time to ramp up to those efforts. However, people talk about these drugs online. This is forum data, and people say really explicit, detailed things about using these drugs. So here's some examples, like how do you smoke salvia? The best way is to use a torch lighter, bong, or pipe. Bong recommended. That's not my recommendation. That's their recommendation. Okay. And hold it in each hit for 20 to 40 seconds. So what we wanted to do was mine user conversations on these sites, all publicly posted if someone wants to ask about that. We didn't use anything that required a username and password. And try and answer some questions for our colleagues who are actually interested in these drugs. So to give you some examples of the questions, how are people using salvia? Salvia is not so new at this point, but how many people have heard of salvia? Okay, does anyone want to say what it is? No? Oh, come on, someone knows what it is. It's not a cartoon. It's not like a new Saturday morning cartoon. So I think this is the story basically. So it's a flower or some kind that you can smoke or do other things with. And basically it was kind of like a couple, like teenagers were using it. It wasn't that popular. And then I think Miley Cyrus was using it, and there was a video leaked to YouTube of her using this. Is this right? And so then everyone wanted to do it, and it's become really popular. Okay, but the point is, it's really popular, and most of you have never heard of it. I'm not going to ask why those of you who have heard of it have heard of it. So basically, we want to answer basic questions about this because researchers don't know these answers. They don't know what happens if you take salvia. They don't know how people are using it. So we've built tools that can discover this and extract it from web forum data. So for example, how people are using salvia, you see for smoking, we have one way. For oral usage, there's another way. And you can see here, we get really detailed information, right? So this is actually really quite useful. Another example, what are the effects of salvia? So we can break out effects by smoking versus oral use. And we can see what differences might arise from different uses of salvia. You'll notice here, this is just a little fun point, all this is in the third person. So he then took one large hit. The reason this is the case is the forums have very strict guidelines against self-incrimination. So everyone talks about someone else. The most common way to do that is use the acronym SWIM, which stands for someone who isn't me. And so someone will say, Swim just had an amazing experience with salvia. Swim went to the club with his girlfriend and right? And it's very funny because it's these clearly firsthand accounts where people are claiming someone else. You also have things like my rabbit Charlie, parentheses, 6'2", 250 pounds, and then smokes salvia and does all these things. It's very interesting. Anyway, so this is really awesome information. To give you another example, bath salts. How many people have heard of bath salts? Not the kind you put in your bath. Lower your hand if you were thinking about that. Okay, so the name bath salts has absolutely nothing to do with the product. They're like these little crystals. I can't remember the actual pharmacological name, but you can take them in various ways, and they have very nice highs apparently with more limited side effects. So these are fairly new. They've been around for about 5 years. They rose to prominence because, does anyone know why some people have heard of it now? Yeah? The YouTube videos. You want to say more?
I think some guy mauled somebody else's face.
Yeah. So there is apparently this interesting effect in some cases where people turn into zombie cannibals. Yeah. And no, I'm not making this up. You can Google it. But there was this guy in Florida who they caught that was really high on this. It was going around mauling people and trying to eat them. So it rose to prominence in that now everyone's heard of it and people want to know more about it, but this drug's been around for a couple of years. So these are kind of comical examples, but the point is there's a whole community of people taking this drug. It has really dangerous side effects. So another one is synthetic cannabinoids. So this is basically synthetic marijuana that in most cases is perfectly legal, but it's actually fairly dangerous. It's not like regular marijuana. And there are tens of thousands of people who are hospitalized every year, a lot of teenagers, because they're like, oh, I'm just taking marijuana, but it's legal because I bought it at a gas station, which is often where they get it, but it's very dangerous, in fact, because it's not actually marijuana. So there's this kind of whole community out there of people using these things. And the researchers really want to know what's going on so that they can actually do something about it. And this sort of data is a really good source for it. So those were kind of just a broad buffet of some very different things we're doing. What I want to say is that these sorts of efforts are really what I think is the tip of the iceberg. There's my iceberg. Presumably, it's much bigger under the water. Okay, that's the point. So what I mean by that is most of what we've been doing so far, at least the stuff I've seen, is replicating things that we already do, but we're now doing faster or cheaper, right? And that's really what disease surveillance is about. Right? Disease surveillance we do a really good job about, but now we want to do it maybe with more fine-grained data like New York, and we want to do it faster. But what I think is the really interesting stuff here is the second half of what I was talking about, and the things I haven't thought of yet, which are things that we can't do. So this drug issue, right, of what drugs people are taking, the effects they have, I think that's fascinating because right now there's no way to get that information. It's just not practical to find it anyway, right? And so we're filling not a need that's caused by data too slowly, but we're filling a need by not having data at all. And I think that's where we're going to have a really huge impact in terms of on public health. So if you have ideas for other things we should do, you should come talk to me. If you want to know the tools we're using, you should come talk to me. I will be on a panel shortly, so you can ask questions. Just to throw in a couple other comments. So I was listening today, and I was taking down some notes of things I wanted to say based on what was said. So a couple this is not related to what I talked about, but I thought people would be interested in this. So a couple of things. So a lot of people here talked about those who are data rich and data poor. So actually, I don't think of it as data rich and data poor. I think the greater divide is people who are familiar with the technologies in computer science and the people who aren't. Because if you're familiar with those technologies, you can actually get lots and lots of data. And so one of my goals here is to make those tools available to everyone. And that's why I want to know what you guys want to do with them, so that you don't need to worry about getting the data and how to process it and sentiment and blah, blah, blah. But we can try and make those tools available so you can run it. I'm not a vendor. That means, one, I don't charge, but also my product isn't nearly as good. But I'd like to try and figure out a way to make this stuff available. Two, geolocation. So someone did mention geolocation is an issue. So let me just throw out some numbers. We're geocoding way more than 1% of the data. We're doing it based on the user location. Here are just some numbers I looked up as we were talking. So this is looking at tweets that have been geolocated by our system and geolocated by Twitter based on the geocodes of the smartphone or whatever. So our country with their country agrees 92% of the time. We're within 250 miles 76% of the time, 25 miles 53% of the time. So this is single tweets. I think if you aggregate multiple tweets, you can probably do better. And there are certainly other things that we're starting to use that are not on this slide and that will allow you to do better. So it really depends on what you need geolocated data for, but we're able to track the flu in New York really well using this sort of data. I mentioned this Twitter random stuff earlier in the day. Keyword selection. So I think the approach we've taken is we're automating our keyword selection. And what that means is we get a bunch of data that reflects what we care about, another bunch of data that reflects what we don't care about, and we let the computer pick out the right keywords. So obviously that's not going to be as good as sitting and handcrafting them with this kind of turnaround, and that's actually like your keywords, because they look much better. But for people who don't have that kind of resources, you can get pretty good keywords by automating things very quickly, and that's what we've been doing. So that's what I wanted to say. Here's a couple papers on what I talked about. I'm happy to answer questions at the panel. Thank you.
Thanks. All right. See if I can get this to work. So, You heard this talk invoked a few times over the course of the day already. I'm Jeff Kahn, the first name on the list there. My colleague Dan O'Connor is sitting at the table. I put his name in brackets because the organization you're about to see is the one I kind of created for this talk. It's really more of comments and remarks based on what has happened over the course of the day than a prepared talk. The slides that I had come with are sitting on a disk somewhere else. It's different than what I had come to talk about. In addition to Dan and I being here, we have a graduate student colleague of ours, Layla Jamal, sitting in the front row, who's trained as a genetic counselor in the PhD program at Hopkins in the Department of Health Policy and Management, studying with us in the track that's devoted to bioethics and health policy. So we've got some bioethics folks in the room. I should just tell you, by way of my background, I'm trained in philosophy. That's my PhD. I have an undergraduate degree in molecular biology, so a little bit of science, and MPH is Master's in Public Health, which means you know enough about public health to know who to call when you have a statistics problem, but you don't know enough to do statistics yourself. Dan is a medical historian by training. So that said, we have some thoughts to share with you. And the way that I think we're going to try to do this is I'm going to sort of start and then pitch over to Dan as he waves his hands, or as I think it would be appropriate for him to comment. And hopefully we'll... this one? Not showing. So I can see it, but you can't. Do we have a tech person in the room that can come and make this show on the screen?
Yeah, we're working on it.
Oh, okay. Well then, we'll just chat. One of the things I think that's been interesting while we wait for this to come up. Good. All right, so there's what I just said, even though you didn't know that it was going. There's our contact information. I also should say you probably have seen Dan's Twitter feed coming up in the course of the breaks. I think among the users who are not was it 200 million who are active? I'm in the other part. So, okay. So here are some things that have come up in the course of the day, and starting with Shrag Shah, but others have brought it up too. So this is just stuff that has been mentioned in the course of today. So what's the right data to collect? How to collect it, how much, especially how to collect what's relevant. What does it mean, and how to validate it? Okay, so that's all from you. What we haven't really heard much about is what are the conditions or limitations of use. We did have a comment from someone who was at that side of the room who I think is not here anymore, who made, I thought, a very good point about the fact that the information coming into these, either fire hose or API or garden hose, comes from individual, real people. It's information from folks who are effectively being treated at some level like research subjects. So that's important, I think, to discuss. Second, and we heard a little bit from Mark just now, but not so much before that, what's the relevance for this information for the public's health versus for other uses? And that matters in how we think about the ethics of research. I'll say more about this later, but I want to just lay it on the table, get on the table now, which is to say we treat things we do in the public's health differently. We infringe people's rights in the interest of public health in ways that we won't in other contexts. And that's, I think, a really important distinction about when we're collecting information about people, its use actually matters. And so as the title of the workshop today is Big Data for Public Health, that's, I think, an important distinction that deserves to be wrestled with. You want to say anything more about that? Okay. And so here we sit. What about ethics? So we started to have this conversation earlier in the day. I kept mum knowing that I was going to have the podium for a little while. But of course, there are lots of issues swirling around. And so I've tried to assert some organization around that. Hopefully it will make some sense. It could have been done lots of different ways, but hopefully it's enough to kick off the conversation. So part of what I think it's important to say that I didn't plan to before coming here, but there's a little bit of history that's really important, which is to say the approaches that we have that you all know from your interactions with IRBs in your institutions are approaches from the 1970s, which were reactions to bad things being done to individual people. right? They were exploited. They were taken advantage of. You know the bad cases, the Tuskegee syphilis study, so-called, but there are lots of others like that. And the regulations that we live with today were crafted to protect individuals from the harms that research might pose. And that's important to understand. I'm not suggesting it's good, bad, or indifferent, but it is the context in which the research protection regime was created and is continued to be employed. And the question is whether it makes sense in 2013 and as we go forward, and whether it makes sense in the context of big data. Very important for us to try to figure out. All right, I already said that. So the important thing to also lay out here is that informed consent, and I've shortened it here to just consent, has traditionally been conceptualized as being an agreement of sorts, a commitment on the part of researchers to behave in particular ways in return for subjects, and we call them that, human subjects, or sometimes participants, but frankly the regulations treat them as subjects, volunteering to participate in what the researchers are proposing. And the question is whether that makes any sense when we're talking about billions of data points coming from hundreds of millions of people. So how do we think about that relationship between researcher and the people whose information we're using, and what we mean by consent in the context of 2013 and big data? I think it is the case that when we talk about consent, that to the extent there is any use of consent and the notion of consent in collection of information that's big data related, is that it's web oriented. So that's when you click on the I agree to the terms of service. That's very different than how we understand the process of consent in the context of research on human subjects. So the problem is we've got consumer platforms being employed for what are research purposes, and there's a real mismatch out of that application. Dan, you want to speak up here? You're still happy to let me keep rambling on. Okay. And then lastly is this sort of notion of regulatory approaches or contractual standards. You must do this in order to go forward versus ethics. So ethics, we hope, are reflected in the regulations that get created, but it's not always the case, and it's not always the case that what the regulations say are all that we have to say about ethics. So IRBs, which you've all dealt with, it sounds like, and have mixed feelings about, as we all do who do research, but they're applying rules that were created and crafted for something that's really quite different than what we're talking about today. And that's just important to acknowledge. So those of you who serve on IRBs, I'm sure can weigh in about the particular stories, but they're a little bit hamstrung by the rules that have been given to them to apply and employ. Yay or nay?
Sure.
Go.
No, right. So I think the other thing about the difference between the regulation, the regulatory apparatus, and the ethics advice that the regulatory apparatus, I should say, it's about medicine and about physical harm, typically, and about the avoidance of physical harm. And one of the great critiques of the IRB system, which is from Zach Schrag, who is a social scientist, is that actually sometimes doing social science research, which is what a lot of people do here, is that there will be some harm to some of your subjects, some reputational harm. If your research subjects are genocidal warlords in East Africa, it's okay if their reputation gets harmed by your research. That's kind of something that happens. Whereas the IRB system is all about avoiding any harm at all to the research subject if possible. And so this attempt to wholesale import a biomedical structure into social science research is very, very problematic. And we see that particularly with big data sets.
And maybe a bridging kind of research would be genomic research, where there's lots of data, but it's biomedical in nature. And we're trying to figure out how to treat that information in the context of a regime, a paradigm that was crafted in the way that Dan just articulated. So this is not related to big data per se. It's actually about genomics research. This was from an article in Nature Medicine, I think, or maybe just Nature. Was a news piece saying the informed consent process is broken when it comes to uses of large amounts of data for the purpose of research. So it's not just us telling you that this is the case, and you sort of know it yourself, I'm sure. So what might we work on together. So thinking about social media content, however you like to describe that, that's the word, the term that I imposed on it, maybe that's not even correct. So should we think about using social media content for research in the context of terms of service? Is that enough? I happen to think the answer is no, for reasons that I'll talk about in a second. Dan and I and Layla were talking to each other in the sort of the breaks and during the rest of today at lunchtime. Many of you, many people today have said it's just part of the nature of social media that you're talking in a public context. You're sharing information in a public context. And so the question is whether the public nature of social media means it's free to use in any way that people see fit. So this is my attempt to make a distinction, which is it's different to say it's free for all to see, which is the case in Twitter and Facebook and lots of other things, but that may be different than free for all to use. And I don't know if you want to buy that distinction or not. I think it's actually important. I know Dan wants to say something about what we mean by public in this context, but that's my attempt to, in very few words, articulate a distinction.
I think that's really important. And there's the notion of the public square, which was raised earlier. Twitter was equated to a public square. The public square, as conceptualized by Jürgen Habermas, or sociologists in that way, is a place of civil discourse between equals. And there are certain expectations about how everyone behaves within the public square, and people who operate within the public square do not use other people within the public square for their own ends, or they at least engage them before use is made of their position and their workings within the public square. And those expectations of privacy and the Habermasian idea of civility between actors. When two people are sitting on a park bench having a private chat, it's out in public. So by that thing, you can stand behind them and listen to it because it's public, they're having a chat. But they clearly have an expectation of privacy there. They have made a private space within a public square. And this happens in Twitter and in other social media spaces. I'm doing some consultancy with a researcher who wants to do a research project on Twitter for mental health users and to identify influential people within mental health community groups on Twitter. And a lot of the people who are using Twitter for mental health data, who are using it for typical sort of health community support. They use it to exchange stories, exchange coping mechanisms. And we've chatted to some of these Twitter users, and they're very worried about that because they're like, I don't want you to be listening into our conversations. And we said, well, do you not realize this is a public space? And they're like, well, yes, but a lot of us have nowhere else to go. We can't leave the house. Some of us are agoraphobic, some of us are exceptionally depressed. This public space is the only place we have to go. And by you asserting it as a public space that you can use for your academic purposes, you've taken something from us. The public space is not there to be exploited for anyone's given terms. It's something that people use for their own benefit and for community benefits. It's not just a free, it's not the buffet, the open buffet at the Chinese restaurant. It's something that people have like vested interests in and something that they have intentions for using. And researchers really have to pay attention to why people are in the public spaces and what they're trying to do in those public spaces.
So among the shortcomings of a terms of use approach, so to sort of pile on here, is that when we talk about participation in research, we require that people have the opportunity to opt out. And we don't ask them why, and we don't put conditions on their opting out. And the problem with terms of service agreements is that you can't use the resource without agreeing to all the terms of use. You can't opt out. And that makes that a clunky application of a way to say we've got agreement to research uses. So the second bullet here is meant to articulate that. So the legal standard may be met, so the letter of the law, but not the spirit of how we understand the ethics of consent in the context of research. So, yeah, please.
Just to add to that, I think there's also an issue about, I hate this phrase, but we as academics and people in the industry who are very digitally literate we might want to check our privilege slightly when we say we understand the risks. We know what the terms and the conditions are. And I forget who it was who said, if you don't want your name to pitch up in an academic presentation, don't go on Twitter. That's fine. We all understand those risks. We are well aware of this. We have the social and cultural capital to make those decisions and to understand what the risks are. Not everybody does. And to say that not everyone understands the risks isn't to underestimate them or to deprecate their autonomy. It's to describe the way that some people do not have the same amount of social capital that we have. And we might just want to check that not everyone is as digitally literate as others. I've never read the terms and conditions of any of the things I do, and I don't think anyone here has, unless they've been doing a very boring project on it. But, sorry, I'm sure it's fascinating. But it's not something that we do. But we know the risks. We're in positions to make those judgments, but not everybody else is. And it's not fair of us to assume that just because you tick the boxes, it abrogates any kind of moral contemplation.
Right. So one question to try to wrestle to the ground here is what criteria might be important in determining whether and under what conditions consent is required. So one way at this in the biomedical research context is to distinguish between identified or identifiable information and truly anonymous. In the genetic context, we're doing away with that distinction because genetic information, the argument goes, is inherently identifiable. But in other contexts, that still may make sense. And in this context, the big data context, it may make sense. I was talking to Darva before he left, and he was suggesting, well, as you take away metadata or things that are useful in research, which could also lead to identifiability, you reduce the usefulness of the information. But maybe that's the price you pay for not having to ask for consent. The other way around this is to say, in public health context, sometimes we don't let people opt out, which is why I sort of was invoking public health as an important feature of the conversation here today. So we don't let people opt out of cancer registries, for instance. It's by law the case that when you have a cancer diagnosis, that gets reported by your physician to the state with your name and all sorts of other information attached to it so that researchers can do the epidemiology of cancer. You cannot opt out. So there's good public health evidence or examples for when we say, well, we let people opt out of research in some contexts, but not this one. So should we think about public health uses and big data as somehow different than research for marketing, recruiting, or other business or commercial related motives? So as it says there, individual rights are trumped by interests in public health, but not so much in other areas. And we know how to think about that. So big data in the context of public health maybe should have different rules or different applications of rules than outside of public health. So lest you think we're just going to chide you here, there are, I think, some ways to go forward. You want to say anything more before I do that? Okay. So we need to think differently. And I say we because it's really a challenge for people who are engaged in this research as well as people like us who think about the issues raised by this kind of research. We need to think differently about disclosures. So in terms of service may actually include information about what data about you will be disclosed, but that's probably not enough. If you don't read it, it isn't really an effective disclosure. We've heard already conversations about committing as a research community to levels of privacy protection. That was early on in the day we had that suggestion come up. And maybe sort of at one end of a spectrum, the maximal end, maybe we modify the consent in the context of big data uses in research to something more dynamic and context-specific than just a checkbox or a click-through approach as we do now. So not in terms of service approach, but something that resembles more informed consent in research. Then there are sort of new and somewhat more technologically sophisticated approaches to allowing individuals to manage the use of information about them. I put here, and I should just sort of as a sidebar say, some places, Hopkins School of Public Health among them, make a distinction, the IRB makes a distinction about what you need to do if it's information about people versus information from people. If it's from them, you have to get consent. If it's about them, you don't. And that's kind of a debate within the research ethics world, frankly, about whether that distinction holds up. But it's a way of allowing public health research to go forward in ways that probably wouldn't happen in other biomedical or social science contexts. So to go back to the point here, there are new technological approaches that are being created and employed to allow individuals to manage who will have access and to what information about them. So you don't have to ask them every time, but people get to dial the amounts of access their information, the kinds of access their information will have in terms of people, third parties using them without having to ask them specifically. I didn't say that very well, but hopefully you got the point. So to kind of wrap up here, Sherry, you earlier in your presentation said when there are insufficient, I don't think you said no, but insufficient research standards that credibility will suffer. I could not have said it better. I think the same is true when there are few or insufficient ethics standards. Credibility may suffer, and in fact may suffer even more, in that we have lots of examples of when there are bad things that happen in the context of a kind of ethics scandal. Research doesn't just sort of suffer credibility, it gets shut down. And that's not where we want to see this go. There's good uses to be had in applications or uses of big data in health, and we need to make sure that those can go forward. So this is my sort of happy send-off, that it's better for the research community and working with people like Dan and Layla and others of us to work together to create standards for what counts as ethically acceptable social media research. And I would say really important for the community to work on that, because if you don't, it will get done to you. Do it to yourself. It's a lot better than having someone else decide for you what the right rules are. So maybe for me, and others can weigh in here, but a big takeaway from today is this is an important time to take this on as an issue and to try to craft principles and criteria and maybe models for what looks like ethically appropriate research involving big data. That's it, yeah.
Just to add one final word, I think to bring transparency about methods, and I think transparency about methods and intentions and uses of research is a really important ethical standard, as well as a methodological, as well as being methodologically sound. It's important for the ethics of the thing as well.
I want to raise the public health exceptionalism argument. I don't see how, I'm not quite sure that that's a valid way to approach it for three reasons. I think a civil engineer could argue that they do things in the social good, for social good. So I don't see how, on what basis we draw that line. Second, what is in the public's good is often, there's not much unanimity in that. Look at the controversy with banning soda in New York. Right? And then third, even from a for-profit versus not-for-profit argument, that, you know, if I do good public health research, maybe I'll get an article in JAMA, and that's going to translate into a higher salary for me. So, am I doing it for profit? I don't know. So I'm just sort of pushing back against the exceptionalism argument for public health.
Well, we can have the argument about whether it's an appropriate exceptionalism, as you put it, but it is in fact the case that the rules have been set up such that we can require people's information to be collected in the interest of public health in ways we can't outside of that context. So, reporting of infectious disease, right? It's mandatory. I already mentioned certain kinds of research registries. And the argument is in those contexts, the interests of the collective outweighs the interests of the individual. Maybe we can make that same kind of argument in other contexts. I couldn't tell by your comments whether you were suggesting that we should treat everything as if we needed consent from individuals or more things as if we did not.
I'm not seeing how being in public health per se sort of gives us license to make that to say that we're different, and therefore we should be accorded this privilege when others are not.
It's typically taken because, as you made it out, Jeff, the collective, because the collective is made up of many, many individuals who interlinked have a set of shared interests. One person's individual interests, which when compared against a single one of those individuals, you might be able to aggregate or argue between the two of them. There is simply no question that one person's privacy not to tell everyone that or not to know that he has a terrible infectious disease is simply outweighed by that, and that's not a question. Similarly, the government, the IRS, it's that tax time of year, they have certain interest in knowing exactly how much income you had. And it's in their collective interest how they represent it to know it. And it's not just in public health, but in this case, it is in the public health interest.
I mean, we could have the philosophical argument, it's John Stuart Mill, it's the harm principle, right? The limits of your liberty are when your actions will cause harm to others. So we make an argument in the public health context. If you have an infectious disease, your privacy liberty is trumped by the fact that our not disclosing that causes harm to others. And that's the basis. It's a long-standing, certainly Western approach to dealing with individual liberty and the powers of the state. We could argue about it, certainly, but I'm describing what is the case. Who's calling on people?
You can't do it.
So, as I read that last slide, the minimum response you said was
I'll go put it back up.
expand disclosure.
I mean, this is very rough, but yeah, we can talk about it.
I probably don't have to require it, but so you said minimally modifying disclosures. So there are two separate issues here. One is the privacy issue. That is, should Sherry show the names of people, and that's under her control. She needs to do that. Particularly if she doesn't need to for some reason show those names, she can avoid that issue. When you come to the more fundamental issue that you raised, which is people's right to opt out of research, so you can't, even though you don't use my name, there's no one who can identify me. Somehow, I have the right to say you can't use my data. I own that data, you can't use it, which seems to be the other issue that you're raising here. The fact is, this data is being gathered for commercial purposes. Without any control of us. We're borrowing it later to try to do what we want to do with it. But clearly, they're not going to change their disclosure forms to benefit us. We're glad when they allow us access to the data. I'm sort of at a loss of how I can understand the privacy issue. I'm at a loss to understand how we allow people to opt out under those conditions.
So to make you feel a little bit better, and Dan can weigh in too, we allow people to do research without consent when it's truly anonymized and you cannot identify the individual. So you don't have to get consent in that context. So there's no opt-out because there's no consent. People don't know that they're participating. So that may cover a whole lot of what you're concerned about, right? The question is whether in a kind of fundamental individual right not to participate in research if you don't want, that's possible in this context. And we'd have to make an argument about why we should treat this differently than we do other research contexts. I guess you could make the argument that we got it wrong in the other research context, but we have committed in a foundational way. Sorry?
Can you say something though about the sort of double standard that exists for all of research right now, where if I'm a private company and I want to do something that is going to make me money, I don't have to go through IRB, but if I'm a researcher and I want to do the exact same thing, I have to go through a lengthy process?
All I would say about that is it's American civics at work, right? We make rules based on when the federal government pays for it, or your institution accepts money from the federal government, you must follow the rules.
I've got an article under review in Bulletin of the History of Medicine, and the whole process in Congress about how the IRB system was created was all about excluding any kind of oversight of private enterprise, because that simply wouldn't have... These terrible scandals that happened, often using private money and often using public money, the only thing that was feasible to regulate was government-funded studies, and so that there's no moral basis to it, there's no moral salience to the distinction between government money and private money, but private money simply was impossible to regulate. It's not right, but it is how it is.
But there's the implication that you should use data gathered legally
No, it's a
under
really-
with private resources.
it's a really interesting
for
question.
legitimate research purposes. Because we don't have the choice of letting people opt out, except we don't use the data at all.
Yeah.
It feels
Or-
frustrating in terms of like what Sandra was saying earlier, like if you're a researcher at Facebook, right, you can do all kinds of things which, you know, the IRB may or may not let you do, which the Access doesn't necessarily let you do unless you collaborate with them,
Yeah.
right? And so, it feels like missing out.
Well, so there's another way at this, which is to make people opt in, right? So rather than allow them to opt out, you say you won't use their data unless they check the right box, which will cost you, obviously, some large numbers of people's data.
And why would Twitter do that?
What's that?
Why would Twitter
Well,
ask
no, I mean, only if they were required to by some authority, I would presume. I mean, part of the answer to the question, your double standard question, is that the executive branch can only make rules about the things that it pays for, right? That's where the NIH lives and NSF and all the things we think about. If Congress, in its wisdom, thought that all research should be treated the same way, they could pass law, right? They've never done that. And so there are good reasons why they've never done that. We have to explain. You know, part of why this didn't matter so much in the past was that either the research was happening in places that did get captured, or if they were private entities, they were submitting their data to the FDA, which is federal too. So they said you have to follow the same rules more or less as federally funded research. There wasn't a lot that fell between the cracks. All of a sudden, we've got a different scenario. And I don't know what will happen. It's a good question. But I know that people are thinking about the issues that are coming up.
And again, the sort of split between medical or biomedical physical research and this kind of social science research, big data research, becomes more and more apparent. Organizations such as Patients Like Me, who a couple of people have mentioned today, they're not at all federally funded, but when they do produce research, they voluntarily submit it to IRBs, to Western IRB or other private, because they know that's what it takes to get it published.
Yeah,
and I know that's what it means to get taken seriously. And so there is an interest, they have an interest
Well,
in
that
doing
may
it.
be the hook too, because you know, in the academic context, you need to follow the rules as they're laid down by the editors. There's a collection of editors of the biomedical research journals that articulate you must follow the rules of protection of human subjects. If that made its way over into your world, then you'd be required to do the same thing.
I think one important thing to say is that the regulations allow the opt-out consent or there to be no consent when there's no harm, where there's very low risk of harm or minimal risk of harm. And a lot of the research we've seen today is very, very low risk of any kind of informational harm, especially the sort of stuff that Mark's doing, which is totally anonymized, and there's almost no way that you could pinpoint any particular person and make any judgment about, you know, race, ethnicity, sexuality, or any sort of potentially prejudicial information. That's not what you're. I mean, he's smiling evilly now, which means he can, but you wouldn't. And so a lot of this research can still go ahead as long as the risks to privacy and people's capacity to sort of self-represent online are not threatened.
So I'll just add one thing to that, because I think there's a conception that you work at Facebook, you can do anything you want. So I talked to people who work for these companies that actually can't do things that I can do. They don't have an IRB, but they have a different standard, which is public perception. And so there are things that I do that people are like, wow, that's really innovative Johns Hopkins research. But if Facebook did, they'd be like, typical Facebook, not respecting our privacy, blah, blah, blah. I'm not sure I'm supposed to give the examples. I can just say I have talked to people at various companies who have said, we've done this and we decided not to publish it or not to do it because of perceptions of privacy, whereas I said, yeah, I would have no problem doing that and I can get approval for it.
Yeah, the study that I've been working on, or the study about mental health on Twitter, the people we talked to were really worried. They were absolutely terrified that this is us surveilling people with mental health problems, and it's an absolute PR disaster potentially.
Even
Precisely what it's interesting and I think valuable too. I mean, getting at, you know, hard to reach vulnerable populations. I mean, that's something that we're all at some level. I mean, we're doing generalizable population research, but at some level, that's what's really fascinating about these data. There's hard to find populations that have acute issues, and mental health patients smoke at 3 times the rate of the average of the population on average. You know, LGBT communities are really hard to get a sense of in population surveys, traditional methods, but I think that there's probably language recognition and social network analyses that can really help us pinpoint these communities of interest, of particularly health implications, that we need the identifiable information.
Yeah.
I think that's absolutely the case. What I would say is that in doing that, we have to be really careful that hard-to-reach communities are not hard to reach because they want to be hard. Some people are hard to reach because they want to stay hidden, right? A lot of the LGBT communities aren't interested in hearing about what the next whatever thing you want to talk to them about, sexual health and risk behaviors. This mental health community that we have been engaging with, they understand that they're an at-risk. This is their safe space. They don't want anyone to come in and identify the influential person who they can change the messaging to come out with a new risk behavior or some kind of thing. They just want to talk to each other together. That's what they want to do. That's what their community is for. And changing what their community is a direct, they conceive of it as a direct harm. But you're absolutely right. There are other occasions in which there are obviously at-risk communities, and I think with adolescents particularly, there are these spaces, but it's really a very fine balance that has to be maintained.
It never occurred. Now that you say it, it seems obvious, but it never occurred to me that there would be communities who are hard to find on purpose.
But,
Yeah.
but what about your public health objection?
Well, right.
You
Yeah,
made
and
a
that's,
public health objection before because you said, in the interests of public health, some communities may be required to divulge information that they wouldn't ordinarily be required
you
to.
have to make the
Even if
case.
the community, so if the community sits there and says, I'm sorry, leave us alone. I want to be left alone. I don't want to talk to you about things. And now you're saying, so you're balancing. I mean, clearly there's always the balance
Yeah, absolutely.
between some kind of health or social good on the one hand and privacy, leave me alone on the other hand.
Or not privacy, right? Because the tobacco industry is allowed to take the data and do whatever they want.
Yeah.
But
Privacy for you and me, but not.
That's a good point, and the industry's doing,
Well-
and the food industry is going after people.
There is a double standard, and I would say it's not something you can point it out, but I'm not sure we can do much about it. Part of what I think needs to be highlighted is that there are harms, reputational and others, and then there are just wrongs, to use philosophers' language. There's no identifiable harm, but it's wrong to infringe my rights. And there are people who feel really strongly about that. I mean, some people don't care at all about privacy, but then there are those who are the really strong privacy advocates. Privacy for the sake of privacy. And if you do something to infringe my privacy without my saying it's okay, that's a wrong that I have a strong objection to and want to prevent from happening to me or anybody else. And that there's a backlash in that is really unhealthy for research going forward. I'm not an anti-research person. I'm just reporting to you, I think, what will happen if people perceive their information being used for research purposes that they didn't understand was the case.
I think that.
Yeah, so I want to explore what you think about what is sort of reasonable expectations, in the sense that specifically you made a comment about people using it, it's like a public square, they are chatting, they have a reasonable expectation of privacy. It's reasonably easy to go to a chat room where it's closed, whatever you're talking about. It's a question about whether you want to discuss what you're discussing in a private square versus the room in your house. You do it in the private square if it is something very important. You wouldn't do it in the public square with the risk of eavesdropping. So somebody who is discussing it knows that there might be eavesdropping. And if you're not concerned, go get a room. And so it's the same here.
Except you might not always have the cultural or social capital to get a room. Rooms might not be available to you if you're discussing a particularly sensitive or potentially stigmatizing subject. So LGBT teens can't go home and chat together in their house if their families happen to be tremendously homophobic, or there's a risk of them being kicked out of the house. And so maybe they do need to go to a public space. Maybe they don't have the capacity to find somewhere safe and secure. And that's the same thing in social media spaces.
Well, so let me give you a very simple thing. You can go do this. Find a teenager using Twitter and ask them if you can share their tweets with their parents. So I think a lot of them would say no. And you can then have a conversation with them about, but it's public and your parents can look and it's all, but like, they clearly don't think their parents are gonna look on Twitter. And so even, this is not a specific group or, anything. This is just average teenagers using Twitter. And that we need to recognize that that's happening.
There's a study to be done about what people understand about the publicity, the public nature of their speaking in these public places.
Yeah, that's one of the other things that's, we say speaking, but it's writing.
Yeah, whatever.
And there's this whole,
by
like,
speech.
putting out the humanities, there's all this interesting, so yeah, but that's
Yeah.
all.
I have a question. I think, really there are two related issues here. One is data access. The other is research result reporting.
Mhm.
If you think about social media, actually social media has a specific characteristic which other data doesn't have, which is you can put any quotes from social media into Google. Very likely you'll find the source. That is, it's even more convenient than gene coding, right?
So it's identifiable. As
Exactly.
Yeah.
Exactly. So maybe it's a two-way street. Maybe that if we develop, I really like your idea of self-policing, or policy creation. If the community created some kind of a ethics standard, right? Because if we think about it, it's very hard to think about a very compelling reason that we disclose a particular tweet, the content of the tweet for analysis. Even in the case like that, one can imagine one can kind of camouflage that to some extent, to say something like this happened, right? To get across the idea of the content. Because really, the meaning of the the study, it must be broader than just a specific word, right? So the specific word is not so important, most cases. So if we can create this kind of a common practice, maybe people then feel more comfortable to allow their conversation to be used for that.
And that distinction that you draw there so nicely between data access and drawing conclusions from data analysis. It's the two sides of privacy. One is your ability to keep all your information to yourself, and the other is your capacity to self-create and present yourself to the world. And the keep information to yourself is the access in terms of social media. And the other side of it is how much do your research conclusions interfere with someone's capacity to present themselves to the world in the way that they want to do. Absolutely, yeah, I think so.
I have two questions that are not exactly related, but they follow from some of the earlier questions. So in reference to the room, the idea of a room, that reminded me of Mark's presentation of the salvia, and I was wondering what your data source was for that. You talked about a chat room or
Sure,
something?
it's drugs form.
So it's drugs, so it's a chat forum.
Yeah,
So
it's
is
a message
that
board.
inherently public? It's a message board, so it's inherently public.
So a couple things. So there are private boards, and we don't use those. We only use public boards, and we only use public boards that are not. You don't even like it's free registration, but we don't even do that. So it all is in that sense it's public. It's IRB approved as well. It's a data source also that we picked because researchers are already using it. So there have been papers published where what they do is they read through all the messages and then make conclusions like what I showed, and our job is to automate that.
No, I was just curious because I've never seen that.
Right, so that's what we're doing there. On those sites also, I said this, there's this policy against self-incrimination, but also it would be very hard to figure out who anyone is on that site. Twitter you could do, but from all the users I've seen, they don't provide nearly enough information. Certainly they don't want to provide enough information because their assumption is that law enforcement's looking through it and all this. I don't know if that's true, but they're purposely trying to hide themselves. So I don't have much faith that will actually come anyway, nor are we looking.
No, I just was curious about that. And the second question I have is to Jeff and when we were talking earlier about that article that you and I had talked about on the phone, and I can never remember the acronym, but I'm just wondering how translatable those guidelines are that you were talking about to what we're talking about, and how much, that we don't really have to, as a community, reinvent the wheel, but we may need to work
Yeah.
on it a little bit to customize it? I
So-
don't know, that's the question.
It's the Association of Internet Research, which are actually not great guidelines.
Okay.
I don't know that I would even start with them.
So that's not a good starting point?
We can look at it and if you want to have the conversation. But
Well, I think there's
but-
a general interest, or at least from a few of us in the room, of,
Mhm.
you know, prospectively working with the RVs and educating the
Yeah.
RVs so that we aren't discredited as a group and really subject to more stringent measures than would be necessary if we did it in a thoughtful, kind of collective way.
I think the Organization of Internet Research, their standards are very much informed by a sort of a horrible phrase like Web 1.0 kind of just pull down. And their new set is trying to react to the social side of things, and I think it's a nice, it just isn't quite. It's a
not
good
quite
place
right.
to potentially start, but it doesn't seem, all the things that we've been talking about today about expectation and these double standards and the public-private divide haven't really come together there.
There's a question down here that
The comment that you made earlier about that LGBT, and if you're trying to intervene, trying to change the policy or something, I mean, that idea is an intervention research, which clearly falls under IRB type thing. Some of the things that we've been talking about here, I think fall more on the observational type research, and that has a continuum as well. There's a point where the IRB says, you know what, that needs human subject protection because people we easily identify, as opposed to the large observational research where you really not going to be able to identify somebody, and then as a scientist you take the protection when you report your data not to. I think with big data, I think that's simple that one size fits all, but it's in a continuum.
Yeah.
And then that a lot of it may be more fully on the observational research, and then what IRBs do with that in that continuum of plan. But one question that I had was around, and we know that field anthropology has had a dark history or at points, and they have a set of ethics in terms of, and that has evolved over time in terms of what anthropologists do when they go into communities and do their observational research, how they report it out. So my question is, what do you guys think about that set of ethics which anthropologists live under when they do their studies?
Two. I mean, and they are. And the interesting thing about the anthropology ethics standards is that they, like all ethics standards, came after a set of scandals. So this is maybe why we want to get in before something terrible happens.
There's a history here.
And there, it's the idea that there must be the sort of underlying thing that's never it's like privacy in in your constitution. It's not written down, but the underlying principle of it is that there should be some form, if not of community consent, the observed community, then no harm has come to the community. And that is I think that's what you might want to be driving for in the big data thing, is either have the generalized consent of the community that you're observing and drawing data from, or that there be absolutely no harm or a very minimal risk of any kind of informational harm. So that's something you could definitely draw from the anthropology side of things. The other thing you might not want to draw from the anthropologist is constantly referring to oneself when you're writing, which anthropologists do, but that's just a prejudice.
Any last questions for the panelists?
So I just wanted to find out what you think about where the ethical lines lie in terms of I could do things where I don't see the data ever. Machines go and do some stuff, and I see limited aggregate data or samples and stuff like that. In that sense, is it okay to suck in everything? So is the violation occurring at the interface of the human computer, or is the violation occurring in the interface of the data computer?
I think it probably depends on the question that you're asking. So, as Dan was saying, if you're asking a question that may yield results which have potential to harm individuals or groups, it doesn't matter whether it's an individual, you, looking at data, or a machine that's aggregating and spitting out answers to your question. So I don't know that that's what's so important, the nexus of the data with a machine or a person, but rather what's at stake.
I think and I won't express it out loud because the language may not be appropriate, but some of you may be aware of Wheaton's law, Will Wheaton from formerly of Star Trek: The Next Generation, which was a guideline for playing online computer games. And there are different contexts in which you can obey or disobey Wheaton's law, and sometimes obeying it in one context means that you'll be disobeying another one, and it's just one that you might want to Google. But there are standards in different communities and different expectations, and I think that's what you have to sort of be aware of.
So I'm sure that everyone is saturated with information and ideas, at least I hope you are. And in some senses, it would be a good time for us to go off and rest a little bit. And those of us who are leaving, we bid you adieu and good safety. And those of you who are joining us for dinner over at the restaurant in the Sheraton, we'll see you about 6:15. Some of the issues that I think we've obviously spent a fair amount of time on have to do with strengths and weaknesses of sentiment analysis and its generalizability. Obviously, questions about privacy and safety and ethics that are wide open questions. A couple of other questions that I think have been important ones that we've given a little less attention to, in my judgment, than we will need to give, but nevertheless are questions of great consequence, have to do with inferences that we make about the data that's out there in the social media environment and the kinds of people who are behind those data. We have a real mismatch. We've done tremendous amounts of work over the course of a very long period of time with public opinion data and very careful samples of human beings. Now we're doing sampling of social media data, and somehow these two sources of information need to be brought together in ways that are consequential, raising ethical issues to a much more complex domain and dimension. But those are certainly questions that we need to be answering. Also, questions about access to these data sources. Obviously, commercial access is one thing, but costs are significant to get commercial access. I want to applaud the people in the room who are trying to make some of these data more widely available and the tools to present those data and to analyze those data more widely available for free to the rest of us, and that is a much appreciated and thankless and endless kind of task. And I guess the issue of standardization came up, not only about the acquisition of data, but also standardization and presenting norms that are well established for the quality of the kinds of data and inferences and coding and so on that are standard in some fields and are only evolving in the fields of social media and big data or computational social science, whatever phraseology you think is consequential. Anyway, those are some of the issues that I think have been, in my judgment anyway, larger scale issues that have infused our conversation over the course of the day. And I don't think we have ready answers to any of them. And before we leave, I'd be happy to hear of any other kinds of big issues that, Sherry, that you saw or that any of the rest of you saw that we can put in front of people so that you can have some categories of things to carry away with you, along with the tremendous complexity and richness of the data that we've information that we've already seen here today. Anyone? I take that as a yes. John.
I just thought that usually we think about smartphone when we talk about social media, but I just want to mention this. Certainly for low-income communities and text messages is very powerful way of communicating. And obviously there is also kind of interesting similarity between text messages and social media, especially Twitter, that short. So I just thought, since I mentioned it, I put it out. I'm sure many people probably here have already thought about it.
One thing I don't want to get into like a big discussion about, but that usually I feel like gets discussed more at workshops like this is training. And we haven't talked at all about sort of what needs to happen in order to do this well with students and, cross-training and the sort of enormous task of that. And so I just sort of wanted to throw it out as for a future meeting or discussion when it's not the end of the day, that we take that up.
I think that's really, really important and consequential. Obviously, if we're going to take advantage of any of these kinds of new developments, and certainly for those of us in communications where the communications world is changing and access to information and data is extremely important, and the training of our own students and ourselves to mine those data well and to take advantage of what's there as rapidly as it's changing is an important teaching and learning test. Anything else? Michael? Anyone? Professor?
I just wanted to not make any substantive comment, but in fact, express gratitude first to Heather for organizing so much for working so hard. To all the speakers and participants, it's extremely valuable, and of course, Bill and Carrie particularly for organizing the conference with us. It was a great day.